Welcome back to the Morning Brew, and I'm Larry Ahrens, along with Matt Gentry, who's co-hosting this week. Pleasure to welcome to our show today Becky Horner, who is State Director of March of Dimes, New Mexico chapter. Becky, good to see you.
Thank you for having me today.
I wanted to tell you that my wife and I had a super time at your recent fundraiser, the celebrity chef thing that you
Yes,
did.
the signature chefs.
Yes, it was such a neat evening.
It was a great turnout, and we've had such good response on the atmosphere and the food and just the night in general. So we're glad you
really
enjoyed
fun.
it.
How come you go to all these awesome parties and you never invite me?
I didn't know you wanted to go.
Always.
Next year,
Okay, next year.
we'll
get in
sign
there.
you up.
It is Prematurity Awareness Month, and this is what March of Dimes is about primarily.
Yes.
Well, let me give you a chance to just explain what the March of Dimes mission is.
Well, our mission is to reduce birth defects, premature birth, and infant mortality. So we do that in different ways, including research, which is a big chunk of what we do, community services, community local grants, education pieces for both professionals and public consumers of healthcare, and advocacy also.
Go ahead, Larry.
Well, you have a report card out on the annual premature birth rate, and I see it in front of you. It's like an actual report card you'd get in school.
It is. It is.
looks like
it's an
this.
actual
It's like
report card.
official. Oh, you can't
It's
really
like
see
the,
it, but
the one I didn't want to show my folks that I got in geometry.
I just forged all my parents' signatures on the report cards. Kids don't do that.
Don't do that. Yeah.
So we got a C.
Yes, and this report card every year is released by the March of Dimes in November, and what it does is it allows us to track the progress of reduction in the premature birth rate. We have a goal as a national foundation to reduce our rate of premature birth to 9.6% by the year 2020. So we've been tracking that, and the good news is that since 2006, New Mexico has reduced our rate from over 14% now to 11.6%. But we still got a C on our report card. We're not a B yet.
Do you have certain demos that have typically more premature births
Yes,
than others?
Hispanics, African Americans, and Native Americans have a greater risk. There are some health disparities there, so a lot of our researchers are looking into why that happens. There are also other risk factors that are really not racial disparities at all, including maternal age. So women who are younger or over the age of 40 automatically have an increased risk of having a preterm birth and delivery. Substance abuse, smoking. We also have an issue of lack of access to care because of poor insurance coverage in our state. So all of those things are things we're working on.
It's amazing, you know, you walk down the mall and you see a pregnant woman smoking. Not
Yeah.
that they smoke in the mall, but you know what I mean. An outside mall.
Yeah. We really are working on programs that help women to stop smoking. In fact, we've funded a couple of local community grants in our state, particularly for prenatal classes that help women stop smoking during their pregnancy and teach them about the importance of not smoking and how that can help their baby's health.
Is it just lack of awareness?
A lot
Is
of
that
that
what it comes down to?
could be.
Or common sense. I mean, not to,
Yeah.
you know.
It could be. I mean, a woman can do everything right, though, and it can still happen.
Yeah.
Oh,
So
that's
that's
true.
why, you know, research is so important. We are going to try to mitigate the things that we know are risk factors, like substance abuse and smoking and drinking and all of those things. But you can still do everything right, and it can still happen. So much more research is still needed.
How does March of Dimes define premature birth? How early is that?
Anything before 37 weeks. A full-term pregnancy is considered 40 weeks, but anything prior to 37 weeks is considered preterm.
I know that March of Dimes has a lot of programs and partners involved. Who are some of those?
Well, one thing we're doing in 4 counties is we have a folic acid education initiative, and we're working with county health initiatives, and we have stakeholders in every county, such as WIC and Molina Healthcare and some of the health clinics, San Juan, McKinley, Bernalillo, and Doña Ana County, and we're working with those to do a folic acid B9 vitamin education initiative. And what they do is they provide training to women who are seeking prenatal education, and they get free vitamins that can help them improve the health of their baby. So,
Now, March of Dimes, you're not physicians, but you do have the info on what it takes to be healthy and active during a pregnancy. And can young women get that info from you?
yes, we have great websites, marchofdimes.org. If you want to learn more about the Prematurity campaign and some of the research that's happening, you can visit prematurityresearch.org. Those are great resources for education of public and professional. We also have something called NICU Family Support. NICU stands for Neonatal Intensive Care Unit.
Right.
And that is a program where we help as a support to families who are going through the NICU experience and help them navigate their time in the hospital. It can be very traumatic. And we also, through that program, provide education pieces to nursing staff to help them better navate how their patients are feeling, how the parents of the NICU babies are feeling, and what they can do to help.
If you only had, could have one message that you could relay from a marketing standpoint, what would it be?
We still have a lot of work to do. 450,000 babies are stillborn premature, 1 out of every 9. We've made progress, but please continue to support the work of the March of Dimes, because we still have a lot of work to do to get where we want to be, ultimately where every baby is born healthy and full term.
Yeah.
That's wonderful. Becky, thank you for being on the show today. Great awareness, and we'll work on the report card a little bit.
Yes,
and
hopefully.
I love the work that March of Dimes does.
Well,
and
thank you for having
keep us in
today.
the loop over here, will you? And let us know
Absolutely.
what we can do to help you.
Thank you very much.
Okay.
Thanks for having me.
Becky Horner, who's State Director of March of Dimes New Mexico chapter, our guest today. And it's Premature Birth Awareness Month, and March of Dimes has all the info. You've seen the website up on the screen. Tell you about an interesting documentary film that's been made and about to be premiered, all about the Harvey girls, a neat historical piece about the Southwest. We'll have that for you in just a moment here on The Morning Brew.